COVID-19 continues to spread across the U.S., touching millions of families. Over the last 16 months, data shows that African American and Hispanic populations have been among the hardest hit by the virus. So joining me tonight to discuss the impact of the pandemic on these communities, researcher and University of Michigan business professor Sarah Miller. Sarah, thank you for being with us tonight.
Thanks so much for having me.
Well, we know you co-authored a new study that focuses on this issue. Other studies have also found higher mortality rates among Black and Hispanic communities, but your research was different. Can you explain that?
So in our study, we wanted to look at the interplay between these disparities by race and ethnicity and also economic measures and economic factors. So we were looking both at factors like being uninsured, being in a low-income household, the type of job that you have that might put you at risk, and how those interacted and interplayed with racial and ethnic disparities that, as you mentioned, have been documented before. And what we found that was very surprising to us was that the racial and ethnic disparities really cut through these social and economic factors. And even within these groups, we still observed really large disparities between African Americans and whites, and to a lesser extent between Hispanics and whites.
So the specific study didn't really focus on the reasons why minority communities were hit harder, but you were talking about other factors like job and home and where you live. And so through your research, did you notice any possible explanations?
It's really hard to pinpoint in any one given study exactly what's driving these disparities. I think one thing that we found very surprising was that when we looked across income groups, for example, African Americans in the wealthiest income group were doing even worse, substantially worse than the poorest white people in our sample. So that was very surprising that it didn't seem to be totally explained by income. Now I think that more work needs to be done to sort of pinpoint the exact drivers of these disparities, but we hypothesize that things like inequality in exposure to pollution or environmental factors, different neighborhood factors, or even exposure to racism or unfair treatment in the medical system could all be things that are driving these disparities, even after accounting for many social and economic characteristics as we did in this study.
So your research really highlights the gap between these communities. What do you think needs to be done to change this?
I think something that's really unfortunate that the pandemic has really brought to light is that even before COVID, there were gaping disparities across communities. And so when COVID hit, it's natural that given the pre-existing disparities that it's going to affect some groups more than others. And so, as I said, we can't completely pinpoint exactly the drivers, but I think researchers and community members need to sort of dig in and determine how we can come up with solutions to these disparate health impacts that we're observing.
Well, Sarah, appreciate your time and your research. Thank you so much.
My pleasure.
All right, Dave.